I'm your host, Vinny Berry. You're listening to the Wrestleville podcast, part of the Fans First Sports Network, where you can find this episode and all our other episodes where you snag your downloads or at Wrestleville.com. And if you listen to us on iTunes and Spotify, please give us likes and reviews. All that good stuff goes a long, long way. My guest, once again, Eric Draven, 34-year professional wrestler. Hey, man, how are you, Eric?
I'm doing pretty good. I just got back from Tennessee yesterday. A good trip down there. Defended the AIWF championship against on Friday Xavier Anthony and on Saturday Greg Anthony. Two totally different styles, father and son they are. And I really enjoyed the whole trip, both matches.
Yeah, I'm familiar with the Anthonys and Greg especially. So yeah, he's gonna bring it, right?
Right, yeah. And like I said, yeah, it's two totally different styles between him and his son. And I mean, I enjoyed both matches a lot. I was really impressed actually with his son on Friday night because I'd wrestled with him before, and each time he gets a little bit better. But I mean, he was really on Friday. So
Yeah, isn't that though for people that are young in the business, uh chances are you're gonna see the growth, right? If they're
right, yeah, and like I see it a lot with my guys up here in Indiana, guys that I train or I'm around while they're training, but I don't notice the growth as much because I see them so often, and where I see Xavier once a month or even less, then each time I see him, I notice significant changes. But I mean, this time he was a totally different wrestler than the last time that I saw him.
good, man, good. Well, I wanted to bring you on. You had told me that you are a big supporter of mental health. You guys have, tell me what your shows do for mental health and
We run weekly on just a regular show that's not a fundraiser, benefit, or anything at all. But quarterly, so like 4 times a year, we run fundraisers for the American Foundation for Suicide Prevention. And the reason is, and like I don't know if you can see my shirt here, but it says Survivor. Almost always, if I'm not wearing my own, you know, my face on my shirt or my company's logo on my shirt, I'm wearing some sort of mental health slogan, Survivor, or the semicolon, or something of that nature. Broken crayon, still color, that kind of thing. Because I myself am a suicide attempt survivor, so I hold it close. And my best friend, she was married to a guy who committed suicide, so um, you know, we have a bond there. And I think everybody struggles with it or knows somebody that struggles with it. Not necessarily, it may not necessarily be to the point of wanting to commit suicide, but definitely depression is probably at an all-time high. Um, so many people are on anxiety meds or need to be on anxiety meds, and then PTSD. And I'm not just talking about like you hear PTSD and you just think military people and police officers or firefighters or something like that. But PTSD affects a lot of people. I'm a childhood trauma victim myself, so I have PTSD. I have night terrors. I'm on a medication to control my dreams. But it doesn't control them. It could, but the side effects outweigh the benefits to some extent.
yeah, right, right. And if you touched on a very good point. PSTD doesn't have to come from serving in a military war, right?
Right.
It can come from any kind of trauma that affects.
And so one thing that I've been going to therapy for a few years now, and I go to a lot of therapy. Like some people, like it's once a month or once every other month, or more severe cases is once a week. I I see 3 therapists every week. So I mean, I'm not saying that my severity of my problem is any worse than yours or anybody else's, because the worst trauma you've ever experienced is still the worst trauma you've ever experienced, regardless of how it ranks compared to someone else's trauma. It's what you know is bad, and it's what your mind goes to in bad situations.
Right.
And so with me, I had abusive step parents, plural. My mom was sh she was an alcoholic, and so she bounced from one bad person to the next bad person, and I'm sure that she had some sort of trauma that she was dealing with as well to lead her to that kind of a lifestyle. And so that stuff affects me. When I dream, I wake up in the middle of the night and I still think I'm that 12-year-old boy. Um, so because the dreams are that real to me. So like it's not a dream, it's a flashback basically. And in that moment, I'm reliving. So when I wake up, sometimes it takes me 10 minutes to realize where I'm at.
Have you noticed, like a improvement as far as the years passed in the treatment and therapy is taking place? Do you feel like you're seeing some progress where it's not as bad as it was?
But so this is a catch 22. Um, I lived most of my life with all this stuff repressed. I escaped. Um, I say escaped. I aged out of being a child, you know. So, but I still went back to traumatic situations. I I left my house before I was 18 years old, and I still went back to these traumatic situations until I was about 19. And basically, at that point, I kind of took the stand and realized I didn't have to endure this anymore. And somewhere along the way, over the next few years, I managed to kind of block it all out. Um, but I was a very unlikable person. So, uh, because I had all this anger and I didn't really know where it came from because I blocked these memories. Um, but I was hateful and I was, uh, one of my friends called it a haunting sadness. Like every good moment, as soon as the, as soon as the adrenaline, the high of like a big wrestling match or whatever was over, and my downtime, I would crash and I would get depressed and I wouldn't know why. Um, it actually came to a point where in in my marriage, it was affecting my marriage because uh, a lot of trauma also affects like one's sex drive and all. And so mine would be polar opposites from one day to the next, or maybe not day to day, but month to month. So like I would go a long time where I had an extraordinarily high sex drive, and then I'd go a long time where I had a zero sex drive, and then my wife had a hard time understanding this. So I we fought over it a lot, and then we had a brief separation. We were still married and intended on being married, but we just had to separate from each other so that we could talk to each other calmly. And then when we did, I let her know a little bit about my childhood stuff that I hadn't really blocked out. But in telling that, it kind of opened up like Pandora's box, if you will, you know? And so I had all this flood back, and things got really bad at that moment in time. That was late 2019. And I started seeing a therapist at that point. Things got a little better, then they got really bad, um, then better, and then worse. And so there's a lot of ups and downs. I think that I have less bad moments now, but my bad moments might be more severe, if that makes any sense.
Right, right. And when you're, I guess, after you talk to the therapist, when you talk, do you feel any relief, or does that kind of bring it back too?
Okay, so I have two different kinds of therapists that I see. Well, three. I have an anger management, which I've pretty basically quit going to. And the reason I quit going to that is um, earlier what I said about how people's trauma compares to another. I was in anger management and I was there with people who were court ordered to be there. And, like we share, you share just like you do in Alcoholics Anonymous or whatever, you know. And the guy stood up and he was there because he was court ordered to be there, because he was beating his wife and his kids. And so I stood up and left because I'm there because of guys like him, you know. So I don't really go to my anger management anymore. But I go to a regular traditional talk style therapist, and my therapist is great. I couldn't ask for a better one. I went through a few before I landed with her. I've actually told her that if she retires or quits or whatever, I'm not sure that I'll continue with therapy because I'm not sure that I can retell my story to another person. It's pretty bad. She joked with me one time saying that after hearing my story, she needs a therapist. So it is a pretty dark story. Um, I feel better when I see her. I feel better knowing that she's there. If I'm having if I'm having a very tragic moment in my life, I know that I can email her and she'll get me in quickly. So yes. And then I also go to EMDR therapy, which is supposed to help with like long term changing the way you process things. It's eye movement, EM desensitization retraining, I think. and it is awful. Like I go there, doesn't matter what kind of mood I'm in when I go there. When I come out, I can't be around people at all. I go to my bedroom with the lights off and the air conditioner on, keep it cold and dark, and I'm there for hours until I can function. So, yeah, it depends on which therapy. My regular talk therapist, yes, the EMDR, the results are supposed to be long term, and so like it's supposed to bring it all to the forefront and allow you to process, and then it's supposed to make it affect you less later. And so I can't tell you if that's working yet or not because I don't really know.
Right. When did you decide to include mental health in your wrestling shows and to make make the awareness a little more in the
So
forefront?
my neighbors, they're not my neighbors anymore, but my neighbors um at the time had a niece or a family member that didn't live with them, but was close enough to them that it affected them, had killed themselves. And while I didn't know the person who killed themselves, I knew the neighbors, and the story was touching to me. And as I said, I'm a survivor myself, 3-time survivor. So it was already kind of sensitive to me. And the, uh, the friend of mine who initially talked me into going to seek help and ended up helping me get the courage in which I did inpatient treatment because I was on the verge of suicide another time after the 3 times that I survived, and she was kind of my encouragement to go there. She has a a husband who had shot himself, and so all these things kind of just combined, and I just felt like it was something. I know a lot of people that is affected by this, so um, and I don't know how they put the dollars to use, but I do know it goes to a good cause and that it goes to helping with ways to help people from feeling the way I felt when I tried to kill myself.
Right. And everybody's I know I'm sure everyone's felt a level of depression or hopelessness, right?
Right.
But
Right.
I mean, for me, and I've known some people who've taken their lives. I've over the years that we've had people close to our families or friends or you know knew somebody that knew somebody, right?
Right.
And yeah, it's well, I'll give you a story. A kid that I went to school with since the 6th grade, and his stepbrother was had committed suicide, and I knew him through knowing his parents. But I didn't know the stepbrother through my friend. I just knew him because I knew that he was the son of my friend's parents, which it all kind of came full circle at the funeral. And he asked me, he goes, "Man, what causes somebody to do this, Vince?" And of course, I didn't have the answer.
I don't think there is an answer. Years of abuse is what caused me to feel low enough and unloved enough and a burden to the world enough that I wanted to. But even still, like I had good moments. I could be in a good mood one day, and then the very next day, um, you know, I I don't see the light at the end of the tunnel, or I believe the light at the end of the tunnel might be a train. So, and I feel the hopelessness still. I mean, like I am 6 years into heavy therapy. I take antidepressants. I did the little DNA swab, which if anybody watching uh, is going through multiple medications, and it feels like you're always just getting the wrong medication. Ask your healthcare provider to do the DNA test. It will knock out all the ones that don't work with your body. And also go to a mental health facility for the mental health meds, not a primary care doctor. I went to my primary care doctor, and I'm not knocking the guy. He's a great family doctor. He takes care of everything else, but it was almost like he was just throwing stuff at the wall and seeing what stuck. And he was giving me so many different kinds of anxiety medicines and antidepressants. I mean, if you name it, I was probably on it. And when they do the DNA test, the results come back, and it's like it's like traffic light. Like a green light means it's good, it will work for you or should work for you. The yellow light means there's these indicators that say that maybe you shouldn't take it, and the red light means there's more than 5 indicators or something like that that you shouldn't take it. And then they have a number that correlates with them. Anything, and each company that does the DNA, the numbers may end up being different, but anything that had a 7 on it, that 7 meant that it actually made your symptoms worse. And several of the medications that doctors, not just my primary care, but other doctors that I had seen over the years had given me for anxiety was actually in that 7. And I'm I have well, it's hard to get the medication you need. And the reason is because people abuse the ones that work. And I am on a benzo, which is one that people would abuse. And at one point, my doctor who prescribed it to me had retired, and then my next doctor took me off of it because he don't like to prescribe benzos because they're highly addictive and sought after by drug users or whatever. And so he kept giving me different medications, and I kept telling him this is the one that worked. And he's like, "Well, we'll try this, and if it doesn't work, well, every time it would be another. If it doesn't work, well, they did the DNA test, and lo and behold, there was only 3 things that worked, and they were all in that benzo category of stuff that he wouldn't prescribe. And I obviously I got the medication back. Nowadays they don't prescribe, like a 30-day supply. I get 10 at a time, and normally because it's take as needed, normally I can go 3 months on a ten pill supply. So like I'm not abusing it. They know I'm not abusing it. They test me and all that kind of stuff and whatnot. And I don't refill the prescription every time it needs filled or every time I could get it filled. So and you got to be honest with yourself with stuff like that. But yeah, definitely recommend getting anybody who is struggling with this to get that DNA test because it'll tell you um, what antidepressants work, what PTSD meds work, what anxiety medicines work, and whatever other mental health medicines you might need, it would tell you.
So for, say somebody, or you're concerned about somebody, or what are maybe the telltale signs of, hey, this person might be contemplating suicide, this person might be in a very dark place. What are some of the signs that might say there's a problem here?
So, people start speaking like they feel like they're a burden to you. Like I don't want to put you out, that kind of stuff all the time. I mean, sometimes they really just don't want to put you out, but if they always feel like just everything, like they're a burden to you, that's a sign. Um, Withdrawal. Like if you go out bowling or whatever with somebody all the time and suddenly they just don't want to go, they don't want to hang out all the time, then there's probably something wrong. And the real unfortunate thing is sometimes you just never know. And I think that I was one of those cases. I think I've always hidden it well. I'm not a very social person anyway, outside of the wrestling atmosphere. I have social anxiety. So in a setting of more than a couple of people, I shut down unless I'm at a wrestling event and then you can't shut me up. But, and I think that my ability to morph into my wrestling character is probably a positive side effect of my mental health, actually, because it's allowing me to escape from who I am, who I was, what I lived through, that sort of thing. But yeah, I think the biggest thing is just like withdrawal, like no interest in anything, that kind of thing. Like if somebody is regularly interested in so many things and it just seems like they don't want to anymore and they're making excuses, that's probably the thing. I mean, I'm not saying that's for sure that they're wanting to, but that's probably the biggest tell.
And do you feel like, have you had like encounters with some people that you think that you've made like a positive impact on? You
No,
know,
I am absolutely certain. And a short story about this. And I mean, we, I, we all probably take for granted some of this stuff, but I had a guy who used to be my tag team partner, and we were already kind of at the end of our friendship. But like I avoided talking to him as much as possible by this point already because we just weren't getting along. But he called me up one night and confided in me that he was wanting to take his life. This was at 7 p.m. I was still on the phone with him at 8 a.m. He thanked me. I mean, like he got through the night, he got through the problem. And a lot of times it is night and day. And it's specifically for me because my anxiety peaks at night. So most of my trauma took place at night. So it's a learned behavior. So at nighttime, you're more alone. There's less people to talk to. You're alone with your thoughts. And this was the same thing for him. So he called me, and luckily I was up, and I mean, it was only 7 o'clock when he called me, but I was up for the conversation, and I kept him on the phone till 8 o'clock in the morning. So we're talking 13 hours with a guy who I really didn't like anymore, but he's still here. Um, he's still here now. We don't talk anymore, but I do feel like, I'm not going to say for sure that I saved his life, but I do feel like I talked him out of at least trying.
Yeah.
And I hope that there's others. There's a kid that wrestles sport for me here at Supreme and has wrestled at OVW a few times, and I'm not mentioning a name because I just don't want to. But I've talked to him a few times when he was really down, and I don't know that he was suicidal, but he was at least not feeling any self worth, and I talked him through and got him to feeling better, and um, I'm not special for this though, because like as many people as I've talked to and helped out, that many people have talked to me and helped me out.
Sure. Absolutely. Absolutely. And the the number 4 suicide prevention is what, 988 is.
Yeah. And so I'm not going to speak against it because if it works for you, it works for you. But I, uh, I just had this conversation with my therapist because I'll be 100% honest. I recently had a almost crisis myself. Since winning the AIWF World Championship, I've almost had a crisis myself. So, so yeah, like I haven't kicked the problem of struggling with it, but I had this conversation with my therapist recently, and she asked me, she's like, um, "Are you safe now?" And yeah, I'm safe. It's like I had a moment, but I feel better. I feel all right. She's like, "Well, in that moment that you can call 988," and I'm like, "That's just not going to work for me because like, I could talk to my wife, I could talk to one of my best friends or whatever, um, but because these people I know and they know me and they care for me and I know they care for me. But when you call 988, you're talking to a random person who doesn't know you. And I just, for me personally, I don't think it would work. Now, I do want to emphasize that most of the people, the 988 people, are doing it for free. So they do care. They're doing it because they're a volunteer and it's something they're passionate about. But to me, I need that connection with somebody for them to help me out in those moments. They're like, I don't understand how somebody who doesn't know me can tell me my self-worth. So, but yes, 988 it is the suicide line, and those people are there to help. And for some people, they do help. It's just not for me.
Sure, sure, absolutely. And we definitely wanna let people know that there is something, right? There is something where people can call because maybe someone's embarrassed to tell somebody they know. We
Right,
don't know where
and
they're
that is
at.
where it would help because, like, again, those people don't know you, so you could tell them whatever you want. Like if you're really in, like, the reason you want to kill yourself is because you've done something and you feel it's so shameful or whatever, or maybe you're living a alternate life that your family doesn't get behind, your sexuality or whatever, and you just can't tell your friends and you can't tell your family. Well, you can tell this person because they don't know you, and so it doesn't matter. And I've never called it, so I don't really know how it works, but I don't think they ask for your name. So, or they might ask for your first name, but not your last name. Uh, and if they ask for your name, it's really just so they can address you during the conversation. I will say that I didn't think therapy would work when I went, but I went because I needed change, and I can't imagine having gotten this far without it. So there's that. A good therapist makes the world of difference. My first therapist, I did not connect well with. I don't know that she wasn't a good therapist. We just didn't work out well together. And then my second one was pretty good, I felt like, and I was starting to connect with. And then once the COVID epidemic hit, I was I couldn't do therapy through a Zoom meeting. So like I just had too much anxiety to do it. So um, discontinued. And when I came back, she was no longer accepting clients. So I landed with another therapist, and I told myself this was going to be my last one. And I'm still telling myself that, but for a different reason. I was like, at that point, it was because I just didn't want to go through the newness again. And my therapist now, her name's Emily. She's fantastic. But she makes her own appointments, which is one thing. The place where I go, they have to make their appointments through the desk, but she's the management. I don't know what it is, but she's the director or whatever. So um, she keeps my appointments at the exact same time every week, which is very helpful to me. And she's, I don't know, she's just good. She's got a good listening ear and a good heart, and just tells me what I need to hear, not what I want to hear.
It's always good to have people like that for sure, right?
Yeah, and I couldn't get through this without my I got a couple of people I call my best friends, and one of them, Natasha's her name. She has gotten me where I am. Like I honestly I wouldn't be here other without her. So everybody needs somebody like that. If you don't have somebody like that, then start with therapy and see if you can get yourself to a point where you can find somebody like that. Um, I don't think you could just look for them though. I don't think you know, they just come into your life or something.
And and if someone was coming to you and said, "Hey, I'm looking for a therapist, and what are maybe some characteristics that I should look for, or some questions I should ask?"
Well, the one thing is some therapists are um, push agendas, like political agendas or whatever. I want one that is just going to stick straight to what is mental health. Um, I go to LifeSpring. It's it's a big company, but um, they there's other therapy places in town. I really think you really just got to try it out, and if it doesn't work, don't give up on the first one. Um, but give it some time. It takes more than 1 or 2 sessions to know if you're gonna mesh with your therapist, I think. Um, but yeah, if you're local to Indiana, I don't know if Life Springs worldwide or not, but if you're local to Indiana, they're everywhere. And they work with your budget. They work with whatever insurance you have, they work with. If you don't have insurance, there's a minimum, like a minimum payment or whatever. Um, it's very affordable for anyone. So you can get your care.
Right. Anything else that you wanted to share with us, Eric, before we let you go?
Well, I do wanna say that even though I said talking to somebody you don't know or talking to somebody I don't know wouldn't help me, if people are friends with me or find me on Facebook or whatever, and they're struggling with this, I will sit there and talk to you. Obviously, don't make up a story just so you have a reason to talk to me or whatever. But if somebody finds me on Facebook and they're struggling with this sort of thing, I'll talk to you. I'll get you through it, or I'll try to get you through it. I'm not a magician, but I will listen to anyone when it comes to this because no matter what you've done or what you're going through, um, if you're not here tomorrow, you can't make it better. So
And
that,
and do you find by helping people, with these kind of struggles, does it help you in a sense of like
um,
taking some pressure off you in that aspect?
so I have a friend, and she has a similar situation to me with some of the parenting that has gone on in her life, and she talks to me about it a lot. And I don't have answers on how to deal with it for her because I'm still figuring it out myself. But I think listening to her gives her somebody to talk to, makes her feel better in the moment. Um, Also, it helps me to feel a little better that I'm kind of not alone in this. Um, some of these things genetically, I think, hit different for males than females. And then there's that toxic masculinity, which for years I didn't know what that meant. I thought it meant something totally different. But for those that don't know, it's like people, I'm sure you're about the same generation as me. So people of our generation, like men aren't supposed to have feelings. You're not supposed to be able to cry. And, like something bad happens, you're just supposed to kind of brush it off and just keep going. And I mean, that's all bullshit. So men have feelings too. Um, the suicide rate for men is astronomical. And the reason is because we don't feel like we could talk to people. And so, and even still, like, I don't, you just heard like everybody that I mentioned that I talked to are female. I don't feel comfortable talking to another man about my problems, you know? I mean, this is fine. What we're doing right now is fine. But when it comes down to really breaking down what's going on inside my head, it's just that we grew up in that era where men don't talk about stuff like that. So it's weird for me to talk to a man. But so one thing that I would say to people is it's okay. It's okay to cry. It's okay to talk. It's okay to have a bad moment. It's okay to do whatever you have to do to just fight through to get through to the next day. And it sucks to think about that all you're doing is trying to get to the next day, but sooner or later, you're not trying to get to the next day. Sooner or later, you're just trying to live your life. But there are days for me where I'm still just trying to do what I can do to pass time just to get to the next day. And if I can make it through tonight, then maybe I can start tomorrow fresh. And a lot of times it is exactly that too. Like I struggle through the night. I wake up in the next morning, I feel fine. I'm all right. Halfway through the day, I'm back to where I was. It's a fight, but we're all in it together.
I appreciate you sharing pieces of your story with us, and thank you. Thank you for coming on. I appreciate you talking about this subject. It's not an easy subject to talk about, and but it does
Hey,
affect.
if I could get a quick plug in
Yeah.
on May 9th in Hanover, Indiana at Southwestern High School, that is our next suicide prevention fundraiser. And I always find it comical is people will be advertising it and they'll call it a suicide awareness fundraiser. It is suicide prevention, not suicide awareness. Everybody's aware that there's suicide. We don't need to make them aware. Let's try to prevent it. But so again, that is May 9th at Southwestern High School in Madison or in Hanover, Indiana. Um, Doors open at 6:30. I don't know the card yet because it's too far off, but that is 100% of the proceeds will go to the American Foundation for Suicide Prevention.
All right. All right. Thank you, Eric. I appreciate you talking to us.
All right. Thank you.
You're listening to the Wrestleville podcast where the wrestling fans live.